Hello, I'm Tom Stevens. Welcome to the Tombot Fireside Chat series. Fireside Chats are educational interviews with experts from the fields of health, technology, and pets, along with stories shared by the family members of those suffering from health adversities. My guest today is Jay Goss. Welcome, Jay.
Hi, good to be here.
Jay is a general partner at Wavemaker 360 Health and serves on Tombot's board of directors. Wavemaker 360 is a Pasadena, California-based venture fund focused 100% on healthcare startups seeking seed stage investment with follow-on opportunities at the Series A stage. Prior to Wavemaker 360, Jay built and ran businesses from early stage startups to building new businesses within very large companies. Jay earned his bachelor's in economics and business from UCLA and his MBA from the USC Marshall School of Business. Jay, for our viewers that are not familiar with the world of venture capital, can you please give us a high-level overview of how a venture fund works?
So at its core, a venture fund is a pool of capital. I run out and get capital from other investors. Those investors could take many forms, from large endowments or pension funds, very large institutions that want to deploy lots of money into the venture capital world, and they invest in funds, all the way down to individuals, high net worth individuals that want to invest into a venture fund. But regardless of the specifics, the goal or the requirement of a venture fund is to raise this pool of capital with the objective then of deploying that capital into some number of startups. So you might raise $10 or $20 million and invest in 5 or 10 companies over a handful of years. You might raise several $100 million and invest into tens of companies over 3, 4, 5 years. But ultimately, the ins and the outs are capital coming in from investors and capital going out into early stage or startup companies.
With limited partners, they're choosing to put their money into a venture capital fund and leveraging your expertise as a professional investor instead of trying to find and diligence their own investment opportunities.
That's right. So limited partners or investors, synonymous terms, that's what they're doing. They could be doing what we're doing as a quote unquote an angel investor. They could be finding their own opportunities, but they probably don't have access to as many investable companies as we do. We do that for a living. So we're out there looking for many hundreds or thousands of companies a year in order to find 5 or 10 or 15 to actually invest into. So we're seeing more investment opportunities. Therefore, it stands to reason we can be pickier, and we're loaded with professionals that know our particular industry. Our particular industry happens to be healthcare, and that's what we focus on, but we can just as easily be doing this for the clean tech industry or the real estate industry or other industries. We just choose to focus on healthcare, and therefore we have a lot of healthcare folks attached to our fund.
And just to follow up on the numbers of deals that you're looking at in a given week, it's always been an extraordinary achievement in my mind to be able to give a qualified look at them. What does a typical day or a typical week look like in terms of the numbers of opportunities that you consider for the first time?
We'll look at between 20 and 40 deals a week, but we're also a 7-person fund. So there's 7 partners here, and so no one of us is looking at all 20 or 40 brand new companies every week, but across the team we're looking at those, and then some of those companies will get a second shake. Some of those companies won't be a good fit for the fund, or the fund is not a good fit for them. And then it's a funnel. Those companies kind of move through the funnel, and out the other end is about, in our particular case, is about 1 new investment per month. We've invested in 39 companies over about 36 or 37 months, so a little bit more than 1 a month.
Wavemaker, as you say, focuses exclusively on healthcare. From an investor's perspective, why are opportunities in healthcare worth exploring?
Our favorite answers to those questions have to do with things that are going on in the healthcare industry. One, the aging baby boomer population. It's not to say that human beings don't get sick or need the healthcare industry's help when they're younger, but in general, human beings need more healthcare as they get older, and that baby boomer population in the United States, this is a US-centric answer, but in the United States, the baby boomers are aging through. We've been hearing about that, the coming of the baby boomers retiring for years and years and years. It's now happening, and that's causing a lot of stress on the US healthcare system. We can't build hospitals fast enough. We can't invent enough technology to be able to take care of this growing, aging population fast enough. So that's one condition in place. The other condition in place is really been seen by probably everybody that's listening to this video, which is over the last 10 or 15 years, almost everybody that's gone to the doctor has noticed that when they check in and they check in with the receptionist and they look behind the receptionist, 15 years ago, there have been 3 or 4 or 5 file cabinets full of all those medical records. And then gradually over the last 15 years, we've transitioned the healthcare industry away from paper-based to digital, electronic medical records or electronic health records. We're now 97% digital in the healthcare industry, close enough to 100% to call it 100%. And if you think about the foundational layer of healthcare now finally being digital, it means a whole lot of technologies can finally take advantage of the situation of the US healthcare system. Many of the technologies that we invest into, the technologies aren't new. They could have been brought to market 5, 10 years ago, but the technology needed to talk to something, and the technologies can't talk to a file cabinet, and a file cabinet can't talk to a technology. So this layer, this electronic medical record layer, had to get into place in order for a lot of the stuff that we're investing in to have a fighting chance to succeed commercially.
Healthcare is often thought about as recession resistant from an economic standpoint. And then of course the COVID pandemic hit. How have you seen in your history how recessions do affect healthcare investments that you've made, and any particular things that might have come up through the COVID pandemic?
Well, it's true. It's empirically true during the life of this fund, and obviously before this fund even existed, that the healthcare industry is probably not recession-proof, but it's about as recession-resistant as it gets. And part of that goes back to the previous comment about the aging baby boomers. We're getting older as a country. More and more people need more healthcare, and more technology, more and more inventions are coming to market. So we're just spending more on healthcare, and we hear about that in the headlines. Percent of GDP as a healthcare spend, it's just been going up and up and up, and every 2 years or every 4 years, we hear about it all over again. COVID's been very interesting. I mean, we're fundamentally a company or a venture fund that invests in companies that do innovation for healthcare. There was definitely a moment around month 3 or 4 or 5 of the pandemic where we were in the deer in the headlights. How is this thing called a pandemic, which none of us had ever lived through, going to affect a young portfolio of healthcare startups? So there was definitely a moment where we were very concerned, but that moment lasted not very long. It became very clear that the pandemic was putting pressure in a positive way on the healthcare industry. And part of that is because so much of what we do, so much of the fund's thesis is around doing more for patients, for consumers that need healthcare services, not inside the 4 walls of a clinic or the 4 walls of a hospital. And then the pandemic comes around, and more of us couldn't be seen in a traditional hospital or in a traditional clinic. You could deliver a baby and people couldn't visit the baby. I mean, they're just on and on, all the stories that were going for the first 6, 8, 10 months of the pandemic. And so many of our companies, and telehealth and remote patient monitoring are examples of that. So many of our companies benefited by this once in a century push to get more things done outside the 4 walls of a hospital, this paradigm of hospital at home. And the country is going to need more of that, because we do not have enough hospital beds to take care of our population. And even if we did, we have a massive labor shortage among nurses. We have a massive labor shortage around doctors. The United States and several countries that are in our situation are going to have to learn how to take care of its population in a less hospital-centric manner. It doesn't mean the hospital is going to go away. You're still going to have your open heart surgery in a hospital, but a lot of things today get done in a hospital that tomorrow will not be done in a hospital. And the pandemic accelerated a lot of the behavior, both among the business side of hospitals, or the business side of healthcare, and the consumer side of healthcare, because the behavior had to change in order for this to happen.
Wavemaker has a wonderful website, wavemaker360.com. I invite you all to visit it. One of the things that you talk about on your website is your secret weapon and superpower in its approach to LPs. Can you explain what you're doing and why it's so valuable to our startup companies and investors?
Yeah, it actually goes back to the core of your first question about what is a venture fund. So our venture fund decided on day one to be focused on a singular industry, the healthcare industry. Most venture funds dabble in 6 or 8 or 10 different industries. They're generalist funds, and their strategy is we're going to invest a little bit in healthcare and a little bit in financial services and a little bit in transportation and a little bit in media, and that gets them diversification. It's a fine strategy. The polar opposite strategy is what we use, which is focusing on a singular industry. We chose healthcare. We took that to the next level when it came to the investors that we wanted to have. So again, we have to have investors in order to have their capital to deploy into companies like Tombot. The vast majority of our investors are healthcare executives. So we have the men and women that are really the captains of industry of the US healthcare system as investors. And that's given us, first of all, it funded the bank account, so now we can invest into companies, Tombot and all the others that we've invested into. But more strategically importantly is we now have the brain trust to be a smarter fund. These men and women are riding elevators every day in the places that they work, getting pitched by entrepreneurs in the healthcare industry. So we're learning about excellent, high-quality investable startups via this army of investors that we have. We have about 150 of these men and women. They help us evaluate. We oftentimes run into a medical company or a healthcare company or a company that's got a specific focus that the folks here at our fund don't know a lot about, and we can call on our limited partners and say, hey, we're looking at this company that's doing X. You know a lot about X. You're the authority on that subject here in the United States. Would you meet with this company and give us a second opinion? Well, we literally call it the second opinion. And so many of our investors help us make more intelligent decisions to invest. They also help us make more intelligent decisions when not to invest. But most importantly, this network of investors that we have, we call on them after we make the investment because they have day jobs that matter. My day job is being a venture capitalist, so I can help the companies that we invest in a little bit, but not nearly as much as the CEO of a health system could do, or an executive at one of the big insurance plans in the United States, or somebody that's working in the post-acute world. Those are the kinds of men and women that we have as investors, and that's music to the ears of the companies that we invest into, because they get a check from us, but almost more valuable, they get our network. And these men and women that are investors in our fund, not only can they help, not only do they want to help, they actually have an economic incentive to help, because the more they help the companies we invest in, the better the fund performs. The better the fund performs, the better all of our investors do. So it really is a very positive, virtuous circle that our formula is based upon.
Certainly from a founder's perspective, it's a hugely attractive thing for us. I mean, capital allows us to bring a product to market, but once we bring it to market, we need to sell it. And having access to the customers is hugely valuable.
Yeah, there's not a company in our portfolio to this day that hasn't been touched by one or more of our limited partners. It's just part of our formula.
Now, Wavemaker 360 typically makes its first investment at the seed stage. Why did you choose to focus the attention of the fund on early stage companies?
We have a very specific theory around that, and we do. We almost always invest at the seed stage. We want to invest in a company that's pure concept, and if a company's already off to the races and generating millions of dollars, it's too late for us. We have that conviction for one reason, and it goes back to our limited partners. Our theory being, if you're blessed with having 150 healthcare executives as investors who are able and willing and motivated to help the companies you invest into, could we move the needle if these companies were a little bit more mature? Probably. We could take them from 9 to 10. We could take them from 8 to 9. But taking a company from 0 to 1 is much more profound value creation. That's where our investors want us to play. That's where they can help these companies. That's where we're going to stick to, because we think we get the maximum bang for the buck, given that we have this secret weapon.
And you may have answered this indirectly already, but You're seeing 20 to 40 deals a week. How do you pick a winner or a likely winner in that sort of sea of immature companies?
There's about 20 answers to that question, and we have a formula-ish. We have a scorecard that we're looking at these different companies. We're going to evaluate a medical device company differently than we're going to evaluate a medical device company that's pre-revenue, different than we're going to evaluate a digital health company that's generating revenue. But one of our biggest considerations, especially given the stage that we invest in, is really getting to know the companies, the people that are running that. Many of the folks at this fund know the good, the bad, and the ugly of what it takes to get a startup off the ground. And almost no startup starts with a plan, gets to success, looks back and said, yep, we followed that plan step to step to step. Things change, the market changes, you have to react, you have to pivot. And so more than anything else, the way overused phrase, you bet on the jockey, not the horse, is how we feel. So we really try to get to know the men and the women of the startups that we're investing in, because we're just convinced that things aren't going to go perfectly smooth. We're not sure where they're going to have the hiccups, but we know the hiccups are coming, and a lot of times it's worse than hiccups. So we spend a lot of time getting to know the team. We care about market size, as most venture funds do, but when it comes to healthcare, it's really hard to find anybody solving a problem in healthcare where the market size is going to be too small. So that's not a very helpful parameter for us. We will look at what proof the company has that there's a fit between the product they're bringing to the market and the market itself. Is there a willingness to pay? Maybe they've even plugged in the cash register and they've got some revenue coming in, although about half of our companies are pre-revenue, half of our companies are post-revenue. List goes on and on and on, but the essence of what we care about is really the team.
Well, speaking of team and product market fit, we had lunch together in the very early days of getting to know each other, and there's a story you like to share out of that. Would you tell everyone about that?
I do remember that. A good Chinese restaurant, and you brought Jenny, and Jenny was on the table. It was just you and I at this table. And, living in Los Angeles, even with lots of celebrities, you see them in all the restaurants you go to. You see people walk up to tables, but I've never experienced it. I've never in my life been sitting at a restaurant, having lunch or dinner with somebody and had pure strangers come up to the table. And that day, that lunch, that's what was happening. And not just once, but several times people came up, kind of interrupted our discussion and asked what this robotic dog was all about. And what was interesting, what was eye-opening, and I think I accused you of hiring actors to come into the restaurant, realized after a while that wasn't true, but what I realized is they almost instinctively knew that it wasn't a toy dog that you buy on aisle 13 at Target. There was something, all of their questions as they approached you and asked what's up with the dog, their mind was around something medical. It might have been, is this something for children with autism? Is this for post-traumatic stress disorder? They were sharing their experiences, but they weren't sharing retail experiences or consumer experiences. They were sharing medical and healthcare experiences. And it was interesting that a dog on a table that didn't have any label that said, hey, come and talk to me about Jenny. This is a medical companion robotic dog. They just instinctively knew it, and they were engaging you for 2, 3, 4 minutes during their conversation, which I, of course, was eating up because I was trying to learn more about the company, and I was getting firsthand data from a restaurant full of strangers asking about a robotic dog on the table of the restaurant.
Yeah, I've since learned that if I don't want to be interrupted, I've got to put a cover on her. A big shout out to the good folks at Jim Henson's Creature Shop. Without their artistic design services, Jenny would never have been so compelling as she is. So thanks again for all of that. From an investor's perspective, what do you see the potential for as Tombot? You already mentioned sort of expanding into related markets like children with autism, adults with other conditions besides dementia. What has been your sort of secret hope for our potential?
Well, we like that we like that there's virtual certainty that the product will be successful in both a consumer-focused marketing strategy and more of a B2B. It's very clear that there's no mystery around it, because your wait list and your pre-orders play this out. This product can be up on a website. People can discover the website, they can discover the product, and they can just buy direct. And they'll buy direct more and more as the product becomes more accepted, as the product actually gets the stamp of approval from the FDA, on and on and on. We love that strategy. And we also love the fact that it will have a traditional healthcare play, where hospitals and skilled nursing facilities and maybe assisted living, other places where it will be marketed, for lack of a better term, to the end consumer, the patient, but there will be a healthcare provider in between. And if you take that to its logical extension, there's also a payer opportunity here. If healthcare providers are interested in putting this in the hands of their patients, and if there is a proven therapeutic benefit, it's not much of a leap of faith to assume that eventually Jenny, the robotic dog, can be covered by insurance, whether that's the private insurance plans, whether that's Medicare and Medicaid, whether that's the VA. Ultimately, we think that's where Jenny goes in terms of a revenue model.
From a practical consideration, we also are trying to think about the caregiver and how Jenny in mom or dad's lap may actually be freeing up the caregiver to cook a meal or go to the restroom or do a load of laundry. Are there other services or other facilities that you see that are focused on the caregiver, and the caregiver becoming more of a spotlight as a target for innovation?
We're actually spending a lot of time looking at this issue. Whether it's because of the shortage of caregivers, which we empirically have in this country, and it's going from bad to worse, or it's just caregiver burnout, if Jenny enriches the life of the user a little bit, and therefore makes it easier and more pleasant for the caregiver to take care of the senior with dementia, whoever the patient is, then it's absolutely serving yet another purpose. And we absolutely believe that. And here we are in a country that, minus Jenny, at the extreme, our country likes to prescribe psychotropic drugs so as to convert grandma or grandpa into a lower quality of life human being, but easier to take care of. We would like to think that Jenny will result in the reduction of the prescription of psychotropic drugs, improve the quality of life for the senior for those last 3 or 4 or 5 or 6 years, and Jenny makes up for what the drug is now not doing, because the drug is not getting into the senior system.
And hopefully, ultimately, reducing the bill to the payer.
100%.
Do you have any advice for investors who perhaps are new to investing in startup companies? Maybe they're experienced in traditional retail investing through stock picking or through mutual funds, but startup investing is higher risk. There's a higher rate of failure with startups. How would you counsel somebody who's new to this to think about investing in maybe their first startup or first few startups?
The thing that we see and we strive to avoid, hopefully we do a good job, relative to the investor that doesn't have as many trips to the plate as we have, is we're very focused on the company's next round. They come to us for a seed round. They come to us usually trying to put together somewhere between a $1 and a $5 million round at a certain valuation. Prior to that, they probably, in most cases, had raised a little bit of capital through friends and family, or maybe some angels, or maybe some grant or non-dilutive funding. But they're going to raise again. And we want them to raise again, because not too often in the history of successful startups does somebody raise a seed round and then never need to raise again, and then one day have a magical, very large exit or go IPO. So the seed leads to the Series A. doesn't always lead to the Series B, but oftentimes it leads to the Series B, and the Series B leads to the Series C, and all the way up the alphabet. So the point being is, when we evaluate a company, when we evaluate Tombot, if our belief is the company's great and the company is very capable of raising a good Series seed, but we don't see them getting to the next level, we ought not put money into the company now. That would be the advice to the investor. Think about the fact that at some point the company's going to have to go, usually up to Northern California, where there's larger pools of capital, and raise a larger round. If they raise $3 million today in a seed, that typically means 18 months from now they're going to raise 5 or 10 or 15 or $20 million in a Series A, and generally that's going to be done somewhere in the San Francisco or the Silicon Valley. And that's a different culture up there, and that's a different sport. So we really try to get opinionated about whether that company can not only be successful now and put the seed round together, but be able to put the round together 18 months later. If they can't do that, then we might as well not put money in now, because the game really gets played at the Series A, not so much at the seed.
Are there any sort of one or two primary indications that you see with whether a company can, make it to a Series A round?
Yeah, the biggest indication is how they're putting their seed together. You can see it. They may not be experienced fundraisers, but they either have a knack for cobbling together 2 or 3 or 4 venture funds. Most of the rounds that we get involved with have a couple angels, have a couple other venture funds, and maybe one hospital is co-investing. That's what a typical Wavemaker 360 round looks like. That's not easy to stitch that together. So to the extent the CEO founder can put together a fairly complicated round of financing at the seed stage, predicts that they're going to be able to do it at the Series A. If they're really struggling putting together that seed, it also predicts they're going to struggle even more when they have to go where the elbows are a lot sharper, the venture capitalists are a lot tougher and harder to work with when you get to Series A and B, and they should be. They're deploying larger amounts of capital. But there's probably some sports analogy that says if you can't really cut it at the junior varsity, you're definitely not going to cut it at the varsity.
From a founder's perspective, raising capital, without question, the single hardest thing I've ever done in my career. You're right. There's a lot of learning that goes on, and you do end up cobbling these together. It's not a single investor who puts you over the top. It's rather a village of investors. And with our Start Engine campaign, our village extends out to even our customers and non-accredited investors as well as accredited investors. Thank you very much, Jay.
You got it. Thank you.
My guest today has been Jay Goss, General Partner at Wavemaker 360 Health. On behalf of the entire Tombot team, thank you for watching. For more information and to learn how you can help us bring Tombot puppies to those desperately in need, please visit our website at www.tombot.com. I'm Tom Stevens. Be well.